First News with Keeler in the morning on WIBX and WIBX950.com.
American Giant makes great clothing, sweatshirts, jeans, and more right here in the U.S. Visit American-Giant.com and get 20% off your first order with code STAPLE20. That's 20% off your first order at American-Giant.com, code STAPLE20.
1 year ago, 82 tests per day. Yesterday, we did 30.
Dr. Kent Hall, just reflecting back from a year ago as we were trying to make our way through what really was, we were in the middle of a real shutdown.
Yeah, we were. And, we thought, this will last, a couple weeks or a month and here we are a year later and we're still, we're still going through it. Although, there is a light at the end of the tunnel, and I do not believe that it is an oncoming train. I do actually believe that we are going to be in a much better place in, as short as a couple months.
Yeah. That had to be a deciding factor for the exciting policy changes for some who maybe were not able to see their loved ones at the hospital.
Yeah.
Right. So, we are starting to, open up some more now and allowing more people in, allowing people to come in when their loved ones are having tests. I would say that, we're looking at that because there are always questions about what does this mean for any particular test or anything like that. So we are tightening that up and making sure that our safety associates at our doors are aware so that they can let people know as they come through.
Interesting as I was just listening to the shows from March and April when we were speaking with you in the very beginning and, learning how to pronounce the names, stuff that's old hat for us today that's just become a part of our everyday language. And then, as Jeff said, the number of tests that we were doing was very, very low. It was hard to get a test and hard to get a hold of a surgical mask to wear.
Yeah, and I remember with actually almost with PTSD, what we were going through in terms of making sure that we could keep all of our staff safe with getting the N95 masks and how that was, how masks that cost, 60 cents per mask went up to, $6-8 a mask. Yeah. I mean, it was really just amazing to go through.
And, just like in the song, where have all the flowers gone? Where did all the toilet paper go? Where did all the Clorox wipes go? And even to this day, it's still those aisles in the grocery store are still not the same.
Yeah, they are a little leaner than they were back in 2019, and I think that people are still making sure, which actually may be a good thing. If the hand wipes and stuff are going out, then that means that people are still doing what they need to do, and that's not a bad thing.
Okay, so it is just over 90 days for me with having the virus. Today, I'm going to be I'll be up at SUNY Poly is where I got my appointment, but I'm getting the vaccine today. What do you recommend for those that are going out to get shot number one?
Yeah, well, for you, it's shot number one, but it's really the second time that your body has seen this type of antigen, and so you may actually have a reaction similar to as if you were getting shot number two. So I would say, you want to make sure that you're drinking plenty of fluids. I would definitely say that you would benefit from some cool compresses at the site of the where the injection is, and certainly using for any body aches or fevers or anything, any ibuprofen or Tylenol for it.
All right, right-handed. From COVID, which is I believe is from COVID, I have really difficult shoulder pain and a weakness in my right arm. Do I get the shot in my left arm and add pain to that arm, or just more difficulty in the right arm?
So I will tell you what I usually do, and I'm also right-handed. I tend to get most, if not all, of my injections in my left side because I need to use my right arm.
Right.
And that's true whether I'm having, shoulder pain, elbow pain from something else or not, and that's simply because even with that, I still need to be able to use my right arm. All
right. Anything else we have? Any advice you give people as we head into Easter weekend, or big families that are getting together, and what is considered to be safely getting together this weekend?
Yeah, so again, I will reiterate what I've said, which is that if you have been vaccinated, your family members have been vaccinated, your friends have been vaccinated, and then I think it is reasonable and safe for you to get together for Easter dinner or whatever your festivities are this weekend. Certainly if that's not the case, if there are people who have not been vaccinated and or have not had COVID in the last 90 days, then you still need to be very safe. And if that means that you can gather outside, I don't know what the weather's going to be, but if you can gather outside and with distance and masks, then that would be better. But enjoy each other. I think that is very important now.
Red in Waterville, a question that came in late yesterday. Do you know anything about people getting shingles after COVID vaccine?
I have not seen any notices in the medical literature or on any of the regulatory websites, the CDC websites, about an increase in the incidence of shingles related to the vaccine. So it can happen to an individual, but it doesn't sound like it is at this time. We know that there is any association with the vaccine.
All right. And really quickly, I promised this woman I'd ask. If she has an autoimmune disease in remission like lupus, would she be safe to get the shot?
So, yes, she should be safe to get the shot. I don't know what medications she's on, so I would say that, given whatever medication she may be on, probably a good idea to have a conversation with her physician. But in terms of general statements, it is safe for people with autoimmune diseases to get the vaccine.
Doc, have a wonderful weekend. Happy Easter, and we'll talk to you next week. We're back on Tuesday, actually, of next week.
Sounds good, everybody. Be safe, and safe travels, Andrew.
Thank you, Doctor.